what is the problem with your weight if you don't eat much, okay? Insulin resistance, just to kind of give you a fancy term out there you guys might have heard of before, is one of the root, if not top rooted problems when it comes to weight problems despite eating. Okay, so let's talk about insulin resistance. What the heck is it? In simple terms, just to let you know, insulin is a hormone that you make that is supposed to metabolize all of that sugar into energy. Okay, but what happens is that with insulin resistance, insulin is starting to get lazy. Okay, and all of a sudden, instead of turning that sugar into energy, it turns it into the form of body fat storage instead. Okay, so again, that's sort of why, if you're hardly eating, why did you blink and you gain 5 pounds? Again, everything is going to storage. Some other features of insulin resistance. Typically, some of our patients primarily tend to crave more sweets and carbs. Now, don't forget, breads and pastas are still on the kind of the carbs and sweet side of things. So those are the typical cravings. Although if you are an individual who works 16 hours a day, doesn't sleep, super stressed out, you are going to knock yourself into the salty and savory side of things. Why? Because then you are actually leaning on a different hormone called cortisol, which is a totally another topic. Okay. There are some women who, whether it was diagnosed in your teens or even in your early 20s or even now in your 30s and 40s, if you have a condition called polycystic ovarian syndrome, guess what? You have insulin resistance. Okay, no wonder you have trouble losing weight. In fact, unfortunately, with PCOS, you might actually have trouble getting pregnant. It's a hormone problem. If you have a family history, I have family who have diabetes all along the side, all along my mother's side, so I'm very cognizant about that. In fact, when I had my daughter Haley 8 years ago, I was diagnosed with borderline gestational diabetes, insulin resistance right there. Okay, so those are the things that you want to sort of kind of look for, okay, well, insulin resistance, so where do these medications come in? So these medications, so just to let you know, Wegovy came out just a little over a year ago. Okay, it does what we call turns your insulin into a super insulin. Okay, so rather than putting all of that sugar into storage like it is right now, Wegovy, I almost call it a sniper for your insulin. It really shifts that pendulum chemistry to get you to regulate your sugars, metabolize. The cool part about it is that it's not only working on your stomach gut system, where it controls your appetite, makes you feel full sooner, it raises your metabolism. So, yes, in fact, not only is it controlling your appetite, but you are burning calories more efficiently. They also recognize that it has some brain chemistry effects where it really helps you to behaviorally, almost, I hate to use this phrase, but sort of feel like a normal person, right? Where you just are able to eat, whether it's a healthy or maybe not so healthy choice, you just are able to comfortably have a normal meal, stop when you feel full. And hey, guess what? Whether whether I used to work in the medical clinic, right? Guess what? Every day was National Donut Day, or it was potluck, or a birthday, someone leaving, someone coming. I mean, I just had to have a hockey stick and check everybody away, from all that food. This medication doesn't even make you flinch.